I know that's probably impossible, but, how do you check out of what you do
Yeah.
every day?
So I would say that it's much better now, versus potentially when I was working at my more community-based social work.
Mhm,
With that, so now we're looking at I did 5 years in community social work. So I was typically on call, technically, for people 24/7 because they were in
mhm,
crisis. I mean, obviously, I survived that and handled that and did that well, right? But it was much more difficult to take care of myself in that manner because obviously, not only as an empath, but also as someone who was the purpose of my job was to be there for that person.
mhm.
um, it can kind of create this unknowing, reliance on being available for people all the time. Um, but now, I mean, even with doula work and especially,
Mhm.
yeah, I know I'm finishing up grad school, but uh, there's such a there's more of a cut and dry in a way of, for instance, I have a session with a client, a therapy client, and I am meeting with them for an hour, and then, you know, then that hour's done. I do my
Mhm.
notes, and then that's done, you
Yeah.
know? I do feel like because there's not that expectation of being emotionally available all the time, that's where I'm able to further take care of myself. Because of course, if there's something very serious going on with a therapy client, I will be like, okay, well, I need to make a note of this, or how am I going to show up and talk about this in supervision potentially.
Mhm.
But that system, just like private practice therapy in general, as a system, looks way different than community social work. And that's not
Absolutely.
anybody's fault, but that system needs to become better in order to not have
Mhm.
people burn out. Right. So,
Yeah. Oh,
um,
yeah.
but yes, the main way that I kind of put things to the side or let things go now is journal about them, talk about them in supervision, and adequately do hobbies and crafts and actively engage with the people I care about in order to
Mhm.
nourish myself again. So,
Yeah, that's absolutely so important, and as you said, kind of in that more social type work, it's almost impossible to stop, being on call 24/7. You're in those
yeah,
crisis situations, and that's a lot. Even the situations themselves is a lot. So, yeah, and the different side of it, you can be a little more relaxed with that. You know that
yeah,
once you're done with your session and notes, you're done with that client for now. Of course, I'm
yeah,
sure you always think of them, and there's times where they may need you
yeah,
outside of the norm, and
of
I'm sure a
course.
doula, babies don't come on a specific time.
Right, right.
So you may
So,
get a call at 2 o'clock in the morning, so
yes, and so that's what I would say too. So, with doula clients, that's a bit different, right? Because,
Mhm,
then even with that though, we're as a doula, like only on call for maybe 3 weeks, four
mhm.
weeks in comparison to their whole pregnancy. That is also way different than being on
Yeah,
call for 6 months with a person that's going through crisis.
yeah, that
And
makes
not
sense.
saying that, my therapy clients and doula clients won't go through crisis, but it's just definitely a different handle of crisis than
Mhm.
what I was doing. Without yeah. So I loved what I did, but I'm definitely happy doing what I'm doing now.
I'm sure that takes a lot on somebody. I know some people that have worked in social work, and it's hard. It's not
Yeah.
easy, so we give you
Yeah.
a lot of credit and are thankful for the time that you did put into that space and that
Yes.
made you who you are and made you more
Yeah,
understanding of
exactly.
situations, so yeah, and I've been
Exactly.
seeing that a lot lately. Going back to how you take care of yourself is writing. That's come up a lot in the last couple episodes that I've done is even in my own life. That's how I, dealt with after my third loss. I just started like blogging and stuff like that. And whether nobody ever sees that or if it's
Right.
personal, like that really does help a lot to get some healing and some thoughts out there. So a lot of people don't even think about that. And that's a way that you can help yourself.
Exactly.